But let's look now those areas where compliance can be affected or can be affected by in the physical therapy practice. What patient compliance means within the physical therapy private practice. How about completed plans of care with an official discharge or final end of care visit? How important is for the patient to have a completed plan of care, that you do not just have to discharge the patient at the end just to close the record from your EMR, but actually the patient has completed their entire plan of care. They have been to an actual final visit. How important that is. How important is it for a patient to maintain the recommended frequency of appointments? When you tell the patient, I want you to come 3 times a week for physical therapy, and the patient ends up coming once a week, or they keep scheduling appointments and missing appointments, how does that affect the patient outcomes and also your practice? Keeping all appointments, making sure that the cancellations and no-shows are very low. How about engaging to any physical therapist recommended additional services? In your office, you may be offering additional services. You may be offering laser. You may be offering insoles. You may be offering massage. You may be offering, like we offer, diagnostic testing. How important is for the patient to engage, to be convinced, to comply with those additional services that you recommend to them? In my opinion, that is one of the most important and most critical points. Specifically, and I'll talk a little bit about that later on, but specifically in our practice, in our situation, and in the practices of more than 185 practices around the country of people that we are consulting and helping to in their practices, that single item, the ability to engage the patient in any physical therapist recommended additional services, can have not only a tremendous impact in the patient care, but a tremendous impact, up to 50% more in the patient value, in the revenue, in the financial patient value, in the revenue that derives from that patient in the practice. And we'll talk more about that later on. And how about assigning within that compliance also the ability to refer friends and family back to the physical therapy practice? So, and it's very important to also look at what is the worth of one appointment. And when that one single appointment is missed, what does that mean? What are the effects of that in the practice? I have an example here for you. I'm taking as an example that a physical therapy patient does, on the average, let's say 10 physical therapy visits during their physical therapy experience, 10 visits. And I'm going to use as amount of reimbursement per visit, $97. And the reason I'm going to use this $97 figure is because this is the figure that was benchmarked from the data from the peer-to-peer group from the private practice section of the American Physical Therapy Association. So if I multiply now 10 visits that the patient is supposed to come in times $97 a visit, many of you are much lower than that. I understand that, but let's work with these numbers now. That patient financial value for those 10 visits are $970. Some of you may be getting less reimbursement per visit, but maybe more visits. So give or take, it's going to be about $1,000, the financial value of that patient. Now, nationwide, physical therapy profit margins, again, based on same data from the private practice section of the APTA, of the peer-to-peer group, 2019, was around 12% across the nation. So in other words, if you are making, let's say, $970, that 12% is approximately $116 of profit you are making from that patient. Okay, so if it was $1,000, it would be $120. Now, what would it mean if this patient, instead of arriving 10 times in their appointments, they arrive only 9 times? What if they miss a single visit, one single visit? What does this mean to you financially? That is a loss of $97. What does that do? What is the impact in actually your final profit margin? It can be very significant. Or what if a patient has 3 times a week appointments, let's say, and misses one appointment because of a no-show or an inappropriate cancellation, where you are unable to fill that spot again with another patient? What happens in that case? And what happens if you have a very low, let's say, percentage of arrivals, where, let's say, only 80% of your patients arrive to their appointments as they're supposed to, and you have a 20% rate of inappropriate cancellations and no-shows? What that impact would be if you are losing 20 visits out of every 100 visits that you are supposed to have in your schedule. That is very, very significant number. Okay, so we're going to talk about how to handle that as well.